Good morning, everyone. We are going to talk today about antepartum hemorrhage. It is defined as any bleeding from or into the genital tract which is occurring after the period of viability. In India, it's taken as 28 weeks. Let's study the causes of it. Causes are placenta previa, abruptio, uterine rupture, and vasa previa. Let's study one by one. Placenta previa is defined as placenta is lying near or over the internal os. Second, abruptio placenta is defined as premature separation of the normal lying placenta. We'll go more deeper into it. Let's understand the pathophysiology. The cause of bleeding in placenta previa is the uterine contractions or the cervical changes applying some shearing forces on the placenta, causing it bleeding. Whereas in abruption, there is damage to the spiral arteries or other blood vessels in the decidua basalis. Blood start accumulating. As damage is occurring, tissue thromboplastin is released, which even activates DIC pathway. It can also cause release of mixed metalloproteinases and other cytokines, which are responsible for pain with bleeding, whereas there is no pain in placenta previa. Coming to the risk factors of placenta previa and abruptio. In placenta previa, the risk factor is previous history of placenta previa, multivital pregnancies, history of previous C-section, as scars are there, and the common risk factors are like age, increasing parity, smoking, and history of curettage and previous uterine surgery. Now coming to the risk factors of abruptio. In abruptio, we have risk factors like preeclampsia to be noted, trauma, and pre-rupture of membrane, premature rupture of membrane, fibroids, and the common ones. Now coming to the difference in the presentation. Both will present as uterine bleeding in the third trimester. As told earlier, there will be pain in abruption and absent in placenta previa. And now coming to the color of blood. Color of blood will be bright red in placenta previa, whereas it will be dark colored altered blood in abruptio placenta. Now coming to the examination finding, and the presentation will be really acute in abruptio, and it will be a chronic process in placenta previa. There can be earlier episodes of small bleeding per vagina in placenta previa, but in abruptio it will be all sudden phenomena. On examination, the vitals will be more deranged in abruptio as it's a large amount of bleeding, and the fundal height will be greater than period of gestation also in abruptio, whereas in contrast in placenta previa, the vitals can be even normal even, and the fundal height will be less, and the uterus will be tender and tense in abruptio, whereas it will be non-tender, non-tense in abruptio. Fetal heart rate will be also similarly like this. There will be fetal distress in abruptio and less chances of fetal distress in placenta previa. And we should never do a PV examination or perspective examination in placenta previa. We need to rule out it first. Now coming to the investigation, we start with the trans-abdominal ultrasound, and then we go for the transvaginal ultrasound to confirm the placenta previa. Whereas in trans-abdominal ultrasound, you can also find a retroplacental clot indicating of abruptio placenta. Now coming to the classification. Classification is really easy. Placenta previa is just classified into two parts, placenta previa and low-lying placenta. Placenta previa means placenta is lying over the internal os, and low-lying placenta is lower edge of placenta is within the 2 centimeter of internal os. And abruptio has its two types of classification. Old classification was revealed, concealed, and mixed, but new classification says type 0, type 1, type 2, type 3. Type 0 is retrospective diagnosis, there are no symptoms. In type 1, there is bleeding and pain, but the FHR is normal. In type 2, bleeding, pain plus FHR is abnormal, the fetus is in distress. Type 3 is the mother is in shock, there is intrauterine death, and she is even in the DIC, and there is even more than 50% of blood loss. Here, just go for termination of pregnancy. Now coming to the management of placenta previa and abruptio. If the vitals are stable, we go for a conservative management. In management, like if the mother is hemodynamically stable there is no fetal distress, period of gestation is less than 37 weeks, there is no continuous bleeding, she is not in labor. All these indications are for conservative management in placenta previa. But if she's unstable, there is fetal distress, or if the period of gestation is greater than 37 weeks, or the patient continues to bleed, or she's in active labor, or it's a intrauterine death, then no wait for even steroid cover, just do the C-section. In conservative management, there is also a McAfee and Johnson regimen where we follow bed rest, monitoring the vitals, steroids cover, MGSO4, tocolytics. These all things are given. But remember one thing: there is no role of tocolytics in abruptio because it can worsen the situation by giving time for DIC and increasing the hemorrhage. Now coming to the management of abruptio, if the patient is unstable, we go for C-section. If she is stable and the period of gestation is greater than 34 weeks, we go for a vaginal delivery. And if it's less than 34 weeks, she's stable, we go for the expectant management and no tocolytics are given. So this was about the management of both of them. Now coming to the next thing, vasa previa means is really simple. There is a fetal blood loss and it's an obstetric emergency. We go for emergency C-section. And uterine rupture, I was telling you, it is usually occurring after the C-section or during the labor. So this was all about antepartum hemorrhage. Thank you for watching.